Big news in the last 24 hours, they've got a vaccine.
So I hear, yeah.
You're up first, group 5, I think you are.
Group 5, is that some sort of age group there, Luke?
I think it's the over 60s.
Over 60s? I don't think I'm quite in that group, but not far off.
Nearly, couple more years.
Very rude. But I've heard that there's talk of dentists administering the vaccine. How come?
That is the gossip coming down the way. Well, I suppose because from their perspective is that they want to get as much vaccine administered as fast as possible. Because whilst obviously there's limited doses of the Pfizer vaccine, should we roll on perhaps a week or so from here, there's hopes that the Oxford vaccine will be available and will be far easier to administer than the Pfizer vaccine, and they'll also have far more doses available. So they want to get it in the population as fast as they possibly can to allow for normal life to return as fast as possible.
And I get all that, but I mean GPs have always been the one to administer drugs and anything that's not oral.
Not normal. Are you an anti-vaxxer, I assume?
I mean, they're the medical people, aren't they? It's not normal for dentists to do.
Yeah, but it is though, isn't it? Because when you go and have treatment at the dentist, they will start by administering anaesthetic. And how do they administer anaesthetic? Often by needle or by injection. Yeah. So they're used to injecting people in the mouth, which is arguably a very tricky area with lots going on. So administering in the arm, into muscle would be far easier than administering in the mouth. So if you think about it, and also dental practices are, there's roughly 12,000 dental practices in the UK. They are already clinical environments that are used to cross-infection and decontamination, which of course is really important when it comes to needles. So in essence, they've got potentially up to 12,000 locations where they could administer vaccine with people who are trained to administer vaccine in a certain area. So it would, in some respects, make sense to use dentists. The question is, as a dental practice, is that do you, taking away, if you like, the wanting to help the national cause, is that do you want to be involved in the administration of vaccine? Because what does that mean for your practice? Does it take away from time when you could be treating patients on a private basis, or picking up mouth cancer? There's always this cause and effect, isn't there? And at what point, does the COVID vaccine become the biggest priority above everything else that's going on? We've already had dental practice closed for a number of months where they couldn't see patients, and thus they were, it's widely anticipated that a lot of mouth cancer, amongst other things, might have been missed during that time.
And I presume it's an additional stream of income for the dentists. I mean, how does that lie with their usual practice income? Are they going to be jumping at it?
Well, they've said that the GPs will pay £12.85 per dosage of vaccine administered, and if we are to believe what the press is saying at the moment, is that both the Oxford vaccine and the Pfizer vaccine would require 2 doses. That's for every patient that has been treated. They're getting somewhere around about £26 per patient. So it all depends with the speed at which they could administer that vaccine as to how lucrative it is. So if you said that, I think I did some sort of rough numbers, and if they were treating, say, a patient every 3 to 4 minutes, then arguably that would work out to be about £192 an hour. But it's how practical is it in a dental practice setting to administer vaccine every 3 to 4 minutes. It's not like a drive-through. I mean, round where I live, there's a drive-through setting, so they can do every 3 to 4 minutes. But in a dental practice, they've got to come in, they've got to see the receptionist, they've got to then go through to the surgery, they've got to sit in the chair, they've got to get them out the chair. And if we're talking about the Pfizer vaccine, that's a novel vaccine, so you can't just administer it and then wave the patient goodbye. Is that then there's a period of time they have to sit in the waiting room, and then you've got to look at waiting room capacity. So there's a few different challenges, and of course from our perspective as a valuation broker, is that what does it do to goodwill? Because you can't really say that there's goodwill associated with what is hopefully, touch wood, unless it does become an annual thing like the flu jab, but
short-term.
It's short-term income.
And do you think it will appeal to NHS dental practices as much as private?
I think for private practice, potentially there's an incentive where maybe books are quieter and you've got spare surgery time, so you could see where maybe there would be an upside of, particularly if you felt the pain over the period of time where dental practices have been closed, or where you've had increased fallow times, you've not been able to deliver the same volume of income, but you can fill spare surgery time with potential treating a vaccine. Whereas in a national health practice, you maybe haven't felt the same financial pain as, or maybe not to the same extent as other private practices had. But then it's a case of if you're doing vaccine and you're not delivering UDA, so at some point, as there's got to be a trade-off, and maybe it is that the NHS will bring in a trade-off, whether you'll be able to do a UDA for COVID vaccine swap, potentially.
Okay, so there are GPs for flu jabs and dentists for coronavirus jabs, and this is the future.
But there are positives, because it may mean that actually, for instance, you may go to a practice in, say, the Central Rugby you've never been to before, and you might go, oh, this is nice, and you might continue to go to the practice.
Yeah, real possibility.
I mean, you could of course have a one-stop shop, so you go in there, open your mouth, have your check-up, and then you get shot in the arm at the same time.
As long as I've got to pay extra.